Hi, this is Colleen Parsons with part 2 of Nose, Mouth, and Throat Assessment. So your subjective data, just like everything else, is very important. You're going to be asking your patient if they have any discharge, if they have a predisposition to frequent colds or upper respiratory infections, sinus pain, have they had any trauma, do they have frequent nosebleeds or recent nosebleeds, do they have any allergies, specifically seasonal or environmental allergies, and do they have an altered smell, which means maybe they aren't able to smell things as well as other people can. For instance, my husband just can't really smell things unless they're very close to his nose. Some things he can't smell at all. So when we're talking about discharge, I want you to take some time and review your subjective data questions. It's always important to ask about pain. And if they've had nosebleeds, you want to ask them how often, how much bleeding. And it can be difficult for a patient to tell you how much bleeding because a teaspoon looks to them like a lot. So we want to review what that looks like in class and remind me to review that. We want to really look at how much blood a teaspoon is, how much blood an ounce is, and you're asking really your patients about clots. When people are bleeding, they think it's so much more than it really is, and we've got some fake blood, and we'll look at that. And here's about allergies and change of smell. Now, it is very important to ask about change of smell because the idea of change of smell, if people used to smell something or all of a sudden they're smelling some different sort of smell, that can be an indication that something is very wrong. When you're looking at their mouth and throat, you're asking them, because you're not looking yet, because this is subjective data, you're asking them about sores or lesions, bleeding gums, altered taste, do they have a history of smoking or alcohol consumption. Tobacco products in particular are important, and while smoking is a big deal, chewing tobacco is a bigger deal, especially for the mouth and throat. We also know that, are you having any difficulty with your tonsils or with your throat? Throat cancer is on the rise. I mean, much of that has to do with HPV virus, and that comes from oral sex, usually. So looking at environmental hazards that might be causing sore throat, some of them are dust or smoke. So I live with wood heat during the wintertime. That's what causes some of my postnasal drip and some issues there. When we get a batch of wood that might have something on the outside of it, I can tell because I immediately get nasally and have some difficulty with my sinuses. Toothaches are important because, again, we want to make sure that our patients aren't being subjected to poor dental care, which can cause systemic bacterial infections. And difficulty swallowing, that is also a big deal. Difficulty swallowing seems to be a bigger deal with people who have GERD, and that's because there's scar tissue around the esophageal sphincter, not allowing it to open up all of the way as the sphincter continues to work to try to keep the acid out of the throat area. And so that makes it quite difficult for people to swallow a piece of meat or something like that. Self-care behaviors, how often do you brush or floss? When was your last dental exam? All of these are important questions when you're talking about the teeth, especially if somebody is demonstrating poor dental care. Canker sores are a big deal, especially for young people. People have a tendency to grow out of getting routine canker sores. They seem to come along from a casual perspective with increased stress, but increased strep infections may also cause canker sores, apparently. And these are just some other kinds of questions that you would be asking a child or infant. Aging adults can get dry mouth, especially with their medications. That's an important side effect to check with because that can deteriorate teeth. You always want to ask your patients from about 20 years old and up, are they able to care for their own teeth? Do they have dentures? Do they have full or partial plates? And that's the end of part 2.